Good morning. Let me thank the invitation. I really value this meeting. This is Yuri speaking. This is a sub-regional meeting. This is a hybrid forum, technical and political at the same time. There is a symmetry here that acknowledges the politics the political aspects of the technical issue, but also the technicalities policies should include. This is an epistemological aspect, and no one is more important than the other. They are equal in relevance. Third, this idea that we can meet around objects without considering our expertise. It is interesting. These are not just expert meetings. We can discuss an issue which is our own issue, and the purposes also guide us. We can contribute different perspectives. We can be here because of the purpose of the meeting without considering where we are coming from. I'm going to show you an equation. This is a Chilean equation. What solution we provided to this equation, and what are the hidden aspects, the hidden variables in the solution. What are the things that we still have to consider? The public sector in health in Chile is really important. A big part of the population is provided medical services in the public sector. This is strange for the country that is considered the most liberal in Latin America. But this health public sector survived some of the transformations that affected public utilities, public education, etc. So this is an issue in our equation, a public sector that is relevant in a neoliberal country, a market with relevant monopolies. Our market is under a lot of pressure from monopolies. If we think about medicines and medical services, there's a part of private medical services, almost 50% have their own medical insurance, but 50% receive medical services from a private sector that is not industrialized as to medicines. Chile was concerned and wanted to produce and create a local, national pharmaceutical industry. We have a company that was protected, that was ruled by a very strict framework, but that was destroyed in the 80s. And the country is very prone to FTAs, has given away everything we can give away. But it is our priority to, in a watching list, we are a top priority in the watching list. In Chile, there are 3 pharmaceutical chains that have a 99.9% market share, and the rest sells nutritional supplements for sports people. The market, not only the industrial market, but the trade market in Chile is dominated by 3 companies, by these 3 companies. Trips, we gave everything we could, so I'm not going to go into details. And we continue focusing on linkage because we still have to execute this obligation the National Institute of Public Health should be linked to the Intellectual Property Institute. Now, what is reality? The same that happened everywhere happened in Chile. The records were created by the big international companies, and it is very much linked to public definitions. You have a curve on the slide that is not just an exhaustion of innovation. I'll try to explain myself. These are the largest patent holders in Chile. This is a registry for trading purposes. What are the local issues? Well, one was the implementation of a public plan that was enforced on the private sector, that is called the GES, Explicit Guarantees in Health. This is a package of therapies funded with a definite funding.
Uno de los roles más importantes que tuvo en
The main role played by the articulation of these packages with medicines with a patent holder relate to HIV, AIDS, because Chile has included in the HIV basket some medicine trademarks, medicines that have a patent holder. Chile negotiated a specific price, and that was the solution to provide access to these medicines. They are guaranteed by the public sector to the private sector. Most of the budget of the HIV/AIDS program is used to pay for the medicines with patent holders. This is losartan. This is used for one of the pathologies. This is an individual product that takes 20% of the budget. Chile actually said, okay, we accept the patents and we're willing to pay to use this medicine in these pathologies. There are 80 pathologies. The remaining diseases have no price guaranteed. And of course, there is some abuse there too. There are certain circumstances in the country that make certain regions live in conditions just before the 70s, like Coyhaique, where you have no private hospital beds. This is a Keynesian region. In the 10th region, there is an island, Chiloé Island, that all hospital beds are public. So these are regions that live in different times. So the public sector in those areas has a power in certain segments or in certain regions, and the power of the public sector there is 100%. These are some of the products included in the baskets of the program that has the guarantee from the states for medicines with patents. And this is the expenditure of the plan. Auge, AUGE. This is the same. He's not finishing his sentences. This is more or less the same. These are the patents granted. This is the official basket of medicines for HIV/AIDS. This is included in the ministry decree. I believe this shows clearly that what drives patentability is the development of these baskets. Now, I would like to go to the hidden variables now, because I believe a stakeholder is missing here: clinics. I believe the mechanism used to create those baskets was through scientific institutions. These institutions set the treatment standards, and we should look there. We should consider the clinic and consider the negotiation possibilities there. I believe clinic is something to look at, because it is a social and technical regime that has economic issues, political issues, but it is a regime, and I believe medicine is a high technical regime, highly sophisticated. I mean, physicians, we are engineers that have different values, different ethics, political issues at stake. But the work of a physician, the clinic physician, is not one-to-one work, but it's very much articulated on these technical objects. So I believe we have to start looking at the agency of technical objects, if there is such an agency, or consider these technical objects as intermediators. I believe that this agency should produce context. Medicines produce their own context through the articulation of networks. That is what clinical matters are showing. What happens in clinical aspects is that networks are dominating, networks of the big circulation of the big pharmaceutical companies, and we are not offering other alternatives. We're forcing upon only one circulation regime. And I set apart the health-related technologies, which is an unilateral way of transforming technicality, the technicality of a medical problem that is subject to evaluations that do not consider the capacity that objects have to continue producing new objects and new networks, and producing an ex-ante evaluation before an ex-post evaluation. So I believe that if this is the case, the supporting network that our countries are producing, the support our countries are giving to this high technical clinical practice of medicine, is because we don't have an industrial structure that would give us alternative possibilities. The situation we are living is a post-war situation, post-war after the 1865 war, the U.S. Secession War, when the idea that Quakers and syrups held the secret of bad medicine, and the monopoly started being linked to medical excellence. And we continue to be under such shadow. So in such circumstances, we should consider these ideas of these technical object agencies that derive from technical studies. And there are two powerful things that result from this. Every matter of concept is a matter of fact. There's not a fact that is a fact. Everything can be controversial. All scientific things are controversial, so this politicity, this technicality are poles that are constantly exchanging things. And if that's the case, maybe economic laws as natural laws that cannot be discussed or challenged should not be seen as civil laws that can also historically and politically evolve. So the discussion would be how to contribute to create these social and technical networks that will allow those matters of fact to become matters of concern with the values that are produced in meetings like this one or produced by our political tradition, our solidarity tradition, our friendly tradition.